excited about talking to you about superbugs. Superheroes against superbugs. Like, because I also come from doing my work on antibacterial resistance and phages and everything. So, so can you tell us a little bit more about it? And it's again a very important initiative, because right now we know, like, we are fighting with TB and all the antimicrobial resistant bacteria and everything. So how did you come about it, and how was it formed?
Yes, so I think I cannot help but agree with you that antibiotic resistance is a really important public health challenge for India. It's a very important area that we should be focusing on in India, but we aren't. Well, I'm trying to remember the exact motivation for why we did this event in Hyderabad. So back in March 2017 or 16, maybe we did a public, we organized a public event around antibiotic resistance, and it was really at this program that I realized how little, or the run up to this program, when I was talking to people about, that we're organizing this program around antibiotic resistance, please do come, and they were like, what is antibiotic resistance? And that's when I obviously realized that a lot of people are completely unaware of this problem and are inadvertently contributing to this. The most well-meaning, well-intentioned people are contributing to this problem purely because they don't know this problem exists. So so from this program, we realized that we need to talk more about this problem of antibiotic resistance, and we started thinking about the audiences we want to reach out to. So when we, in science communication or public engagement, when we say public, we have to define the public. It can't be anyone or everyone, because a message that a child would understand is not necessarily something the adult might relate to or would pay any attention to. And similarly, a message for an urban educated adult might not really be very well understood by someone in a small town or a village. So your messaging, your engagement strategy varies significantly depending on who your audience is. So when we're thinking of who should we really partner with to take this message out to the public, we felt that students would be the best choice. School students would be the best choice because they are enthusiastic, they're imaginative, they're very honest and in their communication. And so we felt that they'll be the best people, and of course they're the future. So of this world, of this country. So we thought, who better than engaging with young students. So we started working on a program where we also wanted to learn ourselves what is the best way to talk about antibiotic resistance, because it's not a disease, right? It's a phenomena. And how do you talk about a phenomena which is becoming a problem, which is something that happens anyway, but it's being accelerated, it's becoming a problem because of human actions. So we thought, through the pilot that we did with these young children in Hyderabad, we thought we'll be able to also understand ourselves what is the best way to talk about this problem. And we realized that, of course, using jargons or scaring people about antibiotics is not the right way to go, because you still do need antibiotics, and you cannot demonize antibiotics when you talk about antibiotic resistance. So it really helped us refine our strategy of how we should be communicating about antibiotic resistance. And it was all because of this work we did with the young children, but of course to help them understand what this problem is and how it impacts them and their lives and their families and community. We had to design a whole workshop, which was very hands-on, very experiential, very introspective, you can say, where where we encourage these students to think about how this problem is affecting them, how it would affect them. And so for that, we had to explain the science behind antibiotic resistance, how bacteria develop resistance to antibiotics, and why slowly this is becoming a problem, and what is that you and I can do to tackle this problem. So yeah, sorry, So basically, I think the motivation was similar to what you said, Kanika, and at the start, that I think there really isn't a whole lot of conversation around this problem in the country. It's not on the health agenda, really. There is a national action plan for antibiotic resistance, but there really is no action happening around that action plan. So, so that's really, there was real motivation behind starting Superheroes Against Superbugs. And I should also mention, sorry, just one last thing, that the name, the Superheroes Against Superbugs was, of course, because we wanted to make it interesting for the for young people. And superheroes are something that they relate to, they like. And then we also wanted to convey this message that anyone who tries to do something about this problem is a superhero. You don't have to wear a cape, you don't have to have special superpowers. You can be an ordinary person who could be doing the right things to address this address this problem. So that's really why we called it Superheroes Against Superbugs.